My name is Jean-Claude Tardif. I'm the director of the research center at the Montreal Heart Institute, and our study presented as a late-breaking trial at the European Society of Cardiology meeting is entitled Antisense Oligonucleotide Targeting ApoC-III to Lower Triglycerides and Atherogenic Lipoproteins in Patients with Hypertriglyceridemia and Cardiovascular Disease. The background of the study is that hypertriglyceridemia is actually associated with increased residual risk for cardiovascular events in patients who are already receiving appropriate lipid-lowering therapies. Now, it turns out that ApoC-III, which is mainly synthesized in the liver, is a key regulator of lipoprotein metabolism and is also involved in vessel wall inflammation. And the reason we are working on ApoC-III is that there have been genetic mutations that have resulted in lowering of triglyceride levels that were also associated with reductions in cardiovascular risk compared to non-carriers of your mutations. And finally, there are epidemiological studies that show that ApoC-III levels do predict cardiovascular risk. So this basically formed a rationale to hypothesize that lowering ApoC-III levels with a drug would reduce triglyceride-rich lipoproteins and ultimately reduce cardiovascular risk. So the study that we conducted was a double-blinded, randomized trial, obviously, that was controlled with a placebo. It was a dose-ranging phase 2 study testing 3 different dosages of the drug called APOCIII-LRX versus placebo in patients who were treated for a minimum of 6 months and a maximum of 12 months. To be eligible to enter the study, patients needed to meet the following inclusion criteria. They needed to have fasting plasma triglyceride levels between 200 and 500 milligrams per deciliter, or 2.3 and 5.7 millimoles per liter. They also needed to have established cardiovascular disease by way of either coronary disease, peripheral artery disease, or cerebral vascular disease. And they also needed to either have be at high risk of cardiovascular disease defined by a number of risk factors and be treated with standard of care preventative therapy for known cardiovascular risk factors. We clearly demonstrated that this antisense therapy called ApoC-III-LRX reduced a number of relevant lipid biomarkers. There was a large reduction in triglycerides from baseline to 6 months with ApoC-III-LRX at the highest dosage of 50 milligrams administered once every 4 weeks, with a reduction of more than 60% in triglycerides, again, during follow-up compared to placebo. Now, we also evaluated the percentage of patients who reached a triglyceride level less than 150 milligrams per deciliter at 6 months. There were basically 91% of patients treated with ApoC-III-LRX at the dosage of 50 milligrams every 4 weeks that reached that relevant threshold, whereas only 4% of patients treated with placebo reached an adequate triglyceride value. Now, we also showed that a number of lipoproteins were significantly reduced by APOCIII-LRX, including VLDL cholesterol as well as non-HDL cholesterol. And there were also significant increases in both HDL cholesterol and ApoA1. Finally, as expected, there were large reductions in the plasma levels of ApoC-III of greater than 70%, with the highest dosage of ApoC-III compared to placebo. We have concluded from this phase 2 study that treatment with APOCIII-LRX resulted in dose-dependent reductions in both ApoC-III and triglyceride levels, up to 74% and 62% respectively compared to placebo. As I said earlier, 91% of patients achieved triglyceride levels less than 150 milligrams per deciliter or less than 1.7 millimoles per liter at the highest dose of ApoC-III-LRX. Furthermore, there were significant reductions in VLDL cholesterol, non-HDL cholesterol, and ApoB, as well as an increase in HDL cholesterol levels during this study. Now, importantly, not only was ApoC-III-LRX efficacious, but we also showed a favorable safety and tolerability profile with adverse events at the injection site that were the most common, but without clinically significant effect on platelet count. And finally, we believe that our results indicate that targeting ApoC-III mRNA may ultimately reduce the residual cardiovascular risk that is present in patients with hypertriglyceridemia. Next steps will be to conduct larger, more definitive studies in phase 3 with this agent, ApoC-III-LRX. Well, the final take-home message for a clinician is that we now have a drug that provides potent reduction in triglycerides, up to 62%, as well as other lipid subfractions, including VLDL cholesterol and non-HDL cholesterol, and as well reductions in ApoC-III. We can achieve these relevant lipid reductions safely with this agent, and that ApoC-III-LRX has the potential down the road to reduce cardiovascular risk in patients that have hypertriglyceridemia despite the current standard of care, including the use of statins.